Welcome to this video, in which we briefly want to give you an overview of the 6 phases that a patient or relative may have to go through when suddenly cancer is a part of their lives. For us at TBA Care, the 6 phases describe a cancer journey in roughly chronological order, because it can be a lifelong process with many aspects and many different paths, involving highs and lows. We use these phases in our work to structure our programs and our private coaching sessions with affected people.
The journey begins with a suspicion phase. This phase starts when you notice something strange within your body. Something new that wasn't there before. A lump in your breast or in your groin. You know it's there, but you just can't explain it. This is the moment that many people start thinking about what it could be. A process that will quickly arrive at what they perceive as the worst case scenario: cancer. Often, Dr. Google has been a contributing factor to these negative mind games. Unfortunately, too often, people try and deal with this part of the journey alone and scared. Not in the least, because the reality of cancer is still very much a taboo in our society today. Taboos unwittingly create feelings of guilt and shame, making the potential recovery even more difficult.
The next phase in our journey is the diagnosis and treatment planning phase. At the end of phase 1, you may have decided to see a doctor. Tests are carried out, and then the nervous waiting for the results begins. This is also testing time for partners, family, and close friends. For the day of the diagnosis, we at TBA Care strongly recommend that you do not go to the doctor alone. If it turns out to be cancer, shock sets in, and you will not be able to comprehend what else the doctor might have to say. This is why the diagnosis and therapy planning appointments should always be separated. That way, you are able to talk to the doctor and decide on your treatment plan rationally and pragmatically. This is also a time where you might want to get a second opinion and gather information about what treatment for your specific type of cancer is available.
The third stop of the journey, phase 3, starts when all the different therapies that might be involved in your treatment plan have been decided upon. We call this the treatment or therapy phase. This phase is defined by the fact that you are confronted with new unfamiliar situations, procedures, and surroundings, all playing a role in combating the cancer. This could be normal medical procedures, such as operations or chemotherapy, but may also involve alternative medicine, such as naturopathic treatment options. Either way, the therapies will have physical as well as mental consequences and side effects. And these are not limited to just the patient. Partners, family, and other supportive people will also be affected. They are just as scared and anxious. Depending on the therapy, this phase can take some time. Motivation and energy may be low, but you should nevertheless prepare for this by rearranging your day-to-day life such that an optimal convalescence can be achieved.
At the end of the therapy, we arrive at the 4th stop of the journey. We call this the remission phase. It starts when the therapy is concluded and the tumors have been reduced or, at best, totally removed. Initially, patients and other affected people have a feeling of excitement and relief. After all, they beat the disease. However, from experience, we know that this initial feeling is quickly replaced by a renewed anxiety. Cancer therapies almost always involve regular checks for a prolonged time after the treatment. And it is these checks that restart the mind games with questions like, will it come back? What did I do wrong the last time that gave me the disease? What can I do now to avoid that from happening again? For the foreseeable future, you will go through a roller coaster of emotions, trying to find a way to live your life normally again. Maybe you want to figure out what you could change in your life, if anything. Trying to cope with this on your own is not recommended. What you need is supportive people around you. The key is talking about it, which creates the necessary understanding you need.
Stop 5 of the journey is the one that nobody would ever want to go through: a relapse or recurrence of the cancer. We would be thrilled if this phase would never happen. Unfortunately, cancer recurrences are sometimes an unwanted part of the journey. Recurrent cancer means that some of the previous cancer cells remained in your body and are now growing again or have metastasized. It could also be an entirely new cancer. Many of the same questions that were relevant the first time are now important again. Again, many decisions need to be made. It is a renewed, difficult and stressful situation where you will be faced with all sorts of emotions. Not in the least a feeling of guilt. Why did it come back? Is it my fault? What did I do to deserve this? But some things are also different. Cancer research, treatments, and you as the patient have all evolved and changed. There are new opportunities that need to be considered.
The last stage, phase 6 of the journey, deals with confronting mortality. This phase concerns another taboo in life, the fact that you may die. Whichever way you look at it, this stage plays an important role throughout the entire journey, because thoughts about death and dying occur as soon as you develop a suspicion, and they continue through therapy and beyond. In this phase, we look at what is important in the final stages of life, what can be done, how you and your relatives can prepare for the moment of death and the time thereafter. Even though we all know that immortality does not exist, many people are still unprepared for this moment. But in this last and difficult phase, it is important that you are able to clear your mind for the inevitable, that you can say goodbye without remorse.
These 6 phases of a cancer journey not only impact the daily life of the cancer patient, but also their parents, family, and other relatives and friends. Generally, a cancer journey is not something you should go through alone. In every one of the 6 phases, you should get yourself support from a trained psycho-oncological cancer coach, such as those from our dedicated training program. They will support you with advice and useful tools, and do so with empathy and care. We are committed to helping people faced with cancer. Our Proven Hope program will help them understand what is happening to their bodies, how best to deal with it, and how best to support any therapy their doctors may prescribe and which they chose to have. All from a holistic perspective. You now have a brief overview of the 6 potential phases that form the basis of our structured programs for people affected by cancer, as well as our Cancer Coach training program.
Thank you for your interest in our work, and we hope to see you in one of our programs. Until then, take care and all the best.